Gulf countries signed the historic Paris Accord to slow global warming.
Now is the time for bold, unprecedented action.
Bagaimana menjamin ketahanan planet ke depan?
Air pollution. Jakarta has been blanketed, you can say, by hazy skies.
Jakarta has the most polluted air in Southeast Asia.
Jakartans at this point will have more than just COVID to worry about in terms of wearing masks.
Indonesia, the archipelago nation of over 17,000 islands with a population of nearly 275 million, with over half the population living on the island of Java alone. The country is known for its lush and adventurous nature, heaven-like islands, but also its bustling cities. The capital city of Jakarta, in particular, has grown massively in size due to rapid industrialization and urbanization. People from all over the country and beyond have flocked to the Big Durian in search for a better life. With this increase in population came an increase in transportation. It is not uncommon to spend several hours in traffic jams in Jakarta. All of these vehicles are contributing to one of Jakarta's major issues: air pollution. In June of 2022, Jakarta was the most polluted city in the world. It is estimated that here, every year, 8,000 Jakartans die because of the consequences of air pollution. Most of the death and disease from air pollution is caused by PM 2.5, tiny particles of less than 2.5 microns that we can easily inhale. We know that PM 2.5 is the main culprit, but how exactly do these particles cause death and disease? To find out, we asked Dr. Feni Fitriani, a pulmonologist at Persahabatan Hospital, how these particles make us sick.
The particulate matter is the most component. It can give the effect from our lung. The particulate matter can enter our lung, can reach the alveoli, and can reach the vascular. And if this component get the vascular, he can through the whole of our body. In vascular, they make the inflammation, and the other effect, and they enter to the cardiovascular, and it can make the hypertension, cardiovascular disease, and in the brain, they can increase the risk from to stroke and cerebrovascular disease, but it takes time, not in acute setting like you get COVID, you meet the people, and several days after that you have the COVID disease. But because the people always stay in the air pollution area, so this mechanism continue on every day, every year. So the risk to get the disease from the air pollution will increase in Indonesia like the other country. I think more than 90% people in all the world living in the bad air quality.
Dr. Fitriani is right. Indonesia is not the only country that is suffering from the effects of air pollution. In the Netherlands, air pollution causes 5,000 deaths annually, most of them from the city of Rotterdam, where PM 2.5 levels can be critical. However, following the Paris Accord, the EU has taken drastic measures to reduce air pollution. We wanted to know what the government of Indonesia was doing to combat pollution. We met with Bondan Andrianu, a climate activist working with Greenpeace Indonesia. He has been working on the issue of air pollution in Jakarta since 2017. We asked him to outline the problems with air pollution that Jakarta is currently facing.
The current air pollution problem in Jakarta started when Greenpeace campaign about air pollution since 2017. That we know the regulations that government hold on the regulations since 1991. It's about ambient air quality standard. It was very old air quality guideline, which under regulation it needs to be revised like at least 5 years, every 5 years. But until 20 years ago, still we are using those regulations.
Bondan told us that the Indonesian government did not take the problem of air pollution seriously enough for many years, despite Greenpeace campaigns. However, everything changed when 32 brave Jakartan citizens decided to file a lawsuit against the government. And they won.
It's not easy for the citizen to have the right, to breathe the healthy air, because 2019 is the official file the citizen lawsuit. The trial is like taking a long way to go until 2021. Finally, the judges read that the verdict of the lawsuit. We won the lawsuit 2021. So we won. So the judges said in the verdict that the defendants are guilty and violating the environmental law.
The lawsuit had three main effects. Number one, it forced the government to update the ambient air quality guidelines, which had not been updated in the past 30 years. Number two, it stated that the central government had to monitor the local government of Jakarta and the surrounding areas on the issue of air pollution. Number three, the government should stimulate public awareness and participation in the fight against air pollution.
The first thing need to deliver to public that yes, a citizen are able to sue government when the government are doing nothing to serve the people, serve the citizen. Yes, we won about it.
Let's take a step back to the basics. We were wondering, what is causing all of this air pollution? And why is it so much more in Jakarta than in other cities?
The cause, that's also the thing that we campaign since the early that we campaign about air pollution, because they don't have a regular research about the sources of air pollution. The biggest is transportation, industries, and then the new found in 2020 data is PM2.5 sources is coming from power plant. So that's also the things that Greenpeace campaign about air pollution, because yes, transportation is the main contributor of air pollution, but we have additional sources of air pollution coming from outside Jakarta, because yes, Jakarta don't have power plant anymore, but the evidence of the research said we have like 15%, if I'm not forgetting, or 14% of PM2.5 is coming from coal plant. It means what Greenpeace campaign about transboundary air pollution, it's real. And even it is admitted officially by the government in 2022, they published a regular air pollution monitoring, like a report, report of yearly air pollution. They said, yes, Jakarta have a transboundary air pollution issues. And yes, Jakarta need more air monitoring devices. Let's say Jakarta need like 43 air monitoring devices. But now we only have 7 officially installed in Jakarta.
It seems as though the government needs more pressure from Greenpeace to take air pollution seriously. So Bondan and his colleagues are happy to deliver that pressure in Greenpeace style.
Even in 2017, it was the first time of Greenpeace campaign and did an action in front of Ministry of Health. We said that deliver the research about the dangers of PM2.5. The answer is Ministry of Health only obligate to research or educate people about indoor air pollution. So it's funny because they divided indoor air pollution and outdoor air pollution. It's kind of silly, it's dumb answer from the government. And next year, 2018, we also the same action, the Greenpeace style, deliver the research from AQI, found it that Jakarta have the worst PM2.5 in Southeast Asia. We put their trophy, number 1. We are the winner of the worst air pollution to the Ministry of Environment and Forestry. We deliver the trophy to them, and we ask them to taking it seriously.
Air pollution is not only an important topic for the government and climate activists, but also for medical doctors. In recent years, we have come to know that climate change will have a huge impact on healthcare in the future. We asked Bondan what he thinks the role of medical doctors is in the struggle towards a cleaner Jakarta.
I think we need to collaborate each other, because the first campaign about air pollution that Greenpeace do in 2017, we also invite experts from the cardiologists. So the one who told to the public about the dangers of air pollution is not Greenpeace, but the expert itself. But I remember from the cardiologist said, this is the time that people should aware. People like Greenpeace should talk more. So it's a proof that NGO, environmental NGO, and experts like in medical should collaborate to deliver to the public what is the reality. Meanwhile, at that time, I still remember in 2017, we have changed to face-to-face meeting with the government, Ministry of Environmental and Forestry. They said, why Greenpeace doing this? You are creating public panic about air pollution. Plus, you are scaring people about air pollution. But that's the important thing. Why? Because when we know that it's dangerous, we need to take many steps to counter about it.
Is it true that there is public panic about air pollution? And are the patients really aware that low air quality can exacerbate their symptoms? We asked 43-year-old asthma patient Tri Hayati about her thoughts.
Paling kalau yang asma saya lebih sering kambuh tuh kalau lagi udara dingin aja.
Tapi kalau asap-asap kendaraan, polusi gitu?
Polusi nggak begitu sih, yang bikin saya sesak kayak gitu tuh ya karena udara dingin.
Maybe in Jakarta, I think to the patient, we should give the education about the disease, so they have to learn about the disease and make the self-prevention. So not, I'm sick, I go to the hospital, doctor, please cure me. So they have to know about the disease and check the condition, and if getting worse, they should go to the healthcare. And this is still, it's need a long work, because to give education and change the people is not easy.
First, about language that you use, how to communicate, educate the public, and then also create pressure to the government to implement what the verdict said in the citizen lawsuit that we won. That's the things. That installing more air pollution device, research about sources air pollution, educate people about impact of health. Even now they are installing and creating website about air pollution officially, but that's it. There is no education to the people. Let's say now we are in the background of early evening, yeah. But we can see that this is not the common sunset in Jakarta. This is this is plus air pollution. So this is the way that maybe we should tackle this one. That public, together with the NGO, together with the expert, create pressure to the government to take it seriously, taking down air pollution. Because when we're taking down air pollution, it's not only benefit for us who live now, but also our descendants in like maybe 20 to 30 years.
And from the healthcare, the professional, research, education, as long as we can.
Jakarta still has a long way to go to tackle air pollution, but with doctors and climate activists spreading awareness and maintaining pressure on the government, we are taking important steps towards a day on which every citizen of Jakarta will take a fresh and clean breath of relief.